Dr. Savita ma'am to introduce our next speaker. Now we are meeting with the very dashing speaker, Poonam Mishra. She is very dashing and she's lot of done the degrees also, MBBS, GNB and FMSc, FGCS, FSRM, FPSM, Fellowship in Aesthetic Medicine, Fellowship in Cosmetic Gynecology, Fellowship in Stem Cell Regenerative Medicine and Psychosexual Medicine also. She is very president also Indian School of Aesthetic Gynecology and she is very dashing and you just listen to her.
Ma'am, thank you for this generous introduction. Thank you so much. And actually, the audience makes a person positive and dashing. So the dashing audience is here, and that is why everything is going to be dashing, you know. To me is the old age and sexuality. And yes, the Geriatrics and Sexuality, the very special one and very neglected one also. Because we live in a society where the old age means the person has now has completed his or her responsibility and is to take care of the family, and the nati pote type wala is the image. But the fact is that sexuality is something which never dies. A person is born with a boy and a girl are very youngsters, the neonates, all are sexual. And we all are, the whole world is running because of someone's sexuality, our parents' sexuality. So how can we deny about this? So I'm starting my presentation with this, the man who is dashing, you know, the man who is sexual and who is proving that yes, this is an essential thing and one should actually. The other person is busy in giving all the lectures and everything, and things are going on. So it is the need of the hour, it is the need of the life, and just to make a person young. So men will be men, it was like that, but women will be women. So sexuality real is something. It is the connecting, everything. So many things are integrated. Body, thoughts and feeling, gender, relationships, values and beliefs, everything is there. So it doesn't mean that, yes, the only sexuality, the only sex and lust is something which is needed in one's life. And so sexuality encompasses sex, gender, identities and roles, sexual orientation, eroticism, so many things. So it could be, like it is intrinsic as well as socially constructed. Sexuality is something which is very much influenced by the society in which we are living, and there has been many articles and many publications which are revealing, like Middle Ages, sexuality in middle age. Covey in 1989 gave that older men who were able to maintain active sex lives were believed to have exceptional qualities, were given high social status, and it was thought to increase their lifespans. Older women who were sexually active were thought to use witchcraft to trick men into going into bed with them. So the society is thinking two different ways. And the other thing, the continued one, assumption that older people are asexual or impotent. Sexuality is taboo, unimportant or irrelevant to older people. Aging is characterized by a continual physical and cognitive decline. The media associates sexuality with attractive youth. So a young person, sexuality means a young person, but हमने देखा अभी लोग शशि थरूर जी को, तो हमारी society is accepting कि नहीं, sexuality is related to every age. Health researchers tend to overlook sexual views of older people. Aging homosexual men have a greater choice of partners and expression of sexuality than older women. So male and female both have got different response from the society, and asexual keepers of knowledge and social mores only. So if a person is aged, if a person is elderly, he has to take care of these things only. And attitude, what is the attitude of the society? It is just like, oh my God, and the age तो देखो इनकी, बुढ़ापे में कब्र में पैर लटकाए हुए हैं और इनकी हालत देखो, इधर उधर नैन मटक्का टाइप, these type of things. कोई उसको एक्सेप्ट ही नहीं करता पॉजिटिविटी के साथ. So idea of sexuality in late life has been denied, regarded with humor, disgust. So denial of sexuality in parents and grandparents become denial of sexuality in all older individuals. So this kind of response is there. Sexuality in aging, there has been a study of 106 cultures, but I have taken a few, like in Kalahari Desert, Africa. So many are accepting that sexuality is something to make the life better, something to make the person active, and some are thinking that sexuality is just for the reproduction and a thing which youth should do only. So these are the things, and in Uttar Pradesh it was quoted that male-female sexual relations are supposed to end after the birth of their first son. This kind of things were there. But challenges to this kind of attitudes are there. Few organizations are there which have come up and they are calling that older adults are and continue to be sexually active well past the arbitrary cutoff of 60 years. In fact, up to the end of life. So nothing like, there is no end to the sexuality of a person, and revolutions have come up in the form of hormone replacement therapy for females especially, and treatment of erectile dysfunction. These two were there which have made revolutions. And there is psychological perspective. Why is sexuality important for the elderly? Is for the quality of life, maintenance of healthy interpersonal relationships, self-concept, integrity, self-worth, and mental health also. So the reproductive phases of human life are there. If a female is born or a male is born, he is going to be in his active life, and the age is declining and would be there in the older age also. And there is the theory of development and aging which is given by Erickson, and stages of psychosexual development is there. So ego is always associated with every phase of life, and that should be taken the advantage of for taking care of everything. At whatever age, everything, some kind of challenges are there from the society for the personality development, So sexual behavior in late life, middle-aged, older individuals continue to be sexually active. Modest decrease in sexual activity is there, yeah. Older men are sexually more active than older women. It is, I don't know how, but yes. And individuals with steady partners are more active than single individuals. So it is like that. The age is there, they are trying to do something, but they don't know. This type of cognitive things would also be there, but sexuality is always there, always in their life. And sexual response cycle, Dr. Ritu had shown a beautiful slide for that. And yes, the problems, sexual dysfunctions could be explained in those regarding these stages only. So sexual response cycle, drive remains the same in both men and women, although frequency may decrease. Arousal is most affected by aging. Orgasm is least affected, although may require more time. Refractory phase is especially affected in older men. And why it is so in females? Because of shortening of and narrowing of vagina, less acidic vaginal secretions, decreased estrogen level, decreased clitoral size, graying of pubic hair. So the confidence level also decreases in females with aging. And there could be atrophy of the urogenital tissue, decrease of vaginal size, decrease in vaginal lubrication, sensitivity of nipples, clitoral, vulval tissue, and sexual desire also decreases. Increased time for sexual arousal is there, and she is suffering from other problems also. Hot flushes, head, neck aches, mood changes, excess fatigue, decreased libido. And many times we discuss it in that way, like ये सास और बहू वाला टाइम होता है. लोग कहते हैं ना घर में गए बहू एंड सास के बीच में एडजस्टमेंट्स नहीं हो रहा है. बट द रीजन इज शी इज सफरिंग फ्रॉम दीज चेंजेस इन हर मूड चेंजेस एंड हार्मोनल चेंजेस आर देयर. उसको इतनी प्रॉब्लम हो रही है, उसको तो कोई सपोर्ट कर नहीं रहा है. एंड दे ऑल नीड कि यस सास ने आते ही बहू को पूरा एक्सेप्ट क्यों नहीं कर दिया. सो मेनी थिंग्स आर देयर. अ फीमेल इज सफरिंग इन हर लाइफ. सो सेक्सुअलिटी इज ऑल्सो अफेक्टेड. And there could be the decreased production of testosterone in cases of male, testicle decreases in size and firmness, sperm production is reduced, prostate increases in size, less pre-ejaculatory fluid, and less durable or firm erections. Less firm and less durable erections are there. So these are the problems, but yes, arousal is there always, and a man and a woman is always sexual throughout her life. So in cases of men, decreased anticipatory arousal is there, more physical stimulation is needed, erection is less frequent, less durable, less reliable, volume is decreased. So refractory period in older men varies from hours to days. In young people, it is for minutes sometimes. So attitude and internalization is also there in cases of males and females. Overreaction to normal changes, decreased sexual activity, lose self-confidence, feels less sexy, feels it is inappropriate or harmful also. They think in that way. And there are positive sides of aging also. Decreased responsibility towards children, emptiness syndrome is there, nobody is there to take care of, and decreased anxiety about the pregnancy. So they can enjoy more if the positive sides are to be taken care of. And sexuality is a long-term care. Privacy for couples is a must, and we have to extend this message to everyone. See, yesterday I was coming and I was at the airport and I was talking to a lady. She was in her 60s or 70s and she asked, why are we going and what is your topic in the conference? I told her about the sexuality. I'm going to talk about the sexuality and the aged couples. And she told that, see, an independent woman and a family which is affluent, nothing like this. This kind of problems are never there. It is only in those societies where the elderly people are dependent upon someone and the society starts rejecting them. So we have to take care of that, and we have to steadily propagate the message that yes, they need the respect also, they need the privacy also, and their even the bedroom भी ले लिया जाता है उनको वो एक बरामदे में, ड्राइंग रूम में, कहीं पे भी होता है कि अब आपका काम खत्म, आप यहाँ रहिए, माता जी आप बाहर रहिए, पिताजी आप अंदर रहिए टाइप्स. क्यों भाई, उनकी प्राइवेसी आपने क्यों ली थी? उन्हें भी जरूरत है प्राइवेसी की, उनके भी दरवाजे पे आपको खटखटाना है घुसने से पहले, ये कोई तरीका नहीं होता है. सो you have to facilitate the conjugal and home visits. Do not disturb signs should be there, knock before enter, and grooming facilities should be there for elderly also. So sexual dysfunctions in late life, they come up in the form of men suffer from ED, more than 50%, 40 to 70 years age group में ये ज़्यादा है. Women in 39%, hypoactive sexual desires, inhibited orgasm, dyspareunia, it is there, and it is there with the youth also. But there, they need the treatment because they are young. How can they suffer from such problems? If an elderly is suffering, तो आपकी तो उम्र हो गई है, आपको तो होना ही है. Type is the response. So the psychiatric problems are also there: anxiety, depression, psychosis, substance abuse, fear of death, MI, dyspnea. So the person is also fearing of some problems, like हम sexuality में engage होंगे some sexual activity और कहीं टपक न जाए, कहीं राम को प्यारे ना हो जाए. Types of thinking is also there. So they need some medical care too, and the sensitivity to loss of physical appearance also. So females suffer more in that way, and control of bodily function, like they suffer from incontinence, some sort of incontinence is also there. Life stressors are there, loss of loved ones, divorce, financial, occupational stressors, they are dependent, many cases they are dependent, and major health scares are there. So major risk factors could be there associated with sexual dysfunctions in the form of diabetes, peripheral vascular disease, CA, pulmonary diseases, stroke, dementia, Parkinson's. Primary effects could be there because of these problems, and there could be secondary effects also: fatigue, pain, disability, medications, beta blockers and diuretics, and STDs and HIV/AIDS are also there in late life, and they have to be taken care of in the same way. They have to be given the proper care in the way the youngsters are being given. Ageism, reluctant to discuss concerns with medical practitioners due to embarrassment, believes that their problems are simple due to normal aging. So doctors are also not giving time to do these patients, and patients are also very hesitant to discuss about their sexual problems to their doctors. Particularly difficult for men to open up, and doctors and physicians tend to generally be uncomfortable about raising the issues. These are the problems. And healthcare institutions and nursing homes are generally not supportive of sexualized behaviors. लिटिल होता है ना, बीमार हैं, इनको तो MI है, इनका हार्ट देख लो, इनका BP देख लो, डायबिटीज वायबिटीज तो नहीं है. Who is going to talk about the sexuality of an elderly couple or an elderly person? So little consultation with residents about sexual needs, psychological barriers such as threats and punishment have been used to control sexualized behaviors. This kind of things are also there. For women in particular, the availability of partners is an issue. Many cases, loss of a partner or bereavement, that is also a major problem. So assessment is the must. Comprehensive medical, psychiatric and sexual history in proper prior sexual experiences, current sexual functioning, attitude towards sexuality and attitude towards any partner, and doctor-patient relationship matters a lot. Treatment should be in the form of education, reassurance, shift focus from intercourse to foreplay, maximize rehabilitation and palliative treatment, analgesics, inhalers, physiotherapy, and treat depression, anxiety, and psychosis in these patients. Medication side effects, wait for tolerance, decrease dose. So medications, proper history of medications, and take care of that also, because any sexual problem could be the side effect of that treatment also. Antidepressant induced EDs could be there. So antidote and many things like these are to be taken care of, and sex therapy. So both partners are to be counseled. Brief educational supportive counseling, intensive couple therapy, cognitive therapy and sensate focus. They all should be imposed upon, and they should be taken care of. Cognitive therapy, so distorted attitude, practical attitude should be there. Catastrophic thinking is there. If I don't achieve erection, I will be rejected by the partner. This kind of thing is always there. So all are nothing. The sensate focus have been discussed. ED is to be taken care of, premature ejaculation. These are the problems. So even youth suffers in the same way. The elderly persons also suffer. Female orgasmic disorders, they could be of more intensity, but yes, they are to be treated in the same way as in the youngsters, in the youth. Dyspareunia, that has to be taken care of, because this is one of the very important problems in cases of elderly females. And way to enhance sexual function in late life is positive attitude, to optimal health, no tobacco, alcohol, communication with partners, foreplay. Foreplay matters, and they have to be told that just give time, be cozy to each other, the way you have always been to each other in your early life, and treat medical problems also, and give some time to your desires, the way the humor and all, everything, friends, just visiting in parks, giving time with friends and enjoying. Another thing should be there. Way to enhance sexual function in late life is before sex, take painkillers or inhalers. Females should use estrogen cream, identify problematic medication, avoid unrealistic expectations, and explore positions also. And this could also be done if nothing is remaining. Yes, as soon as the Viagra kicks in, game is on, they're just playing. So anything. And the last message is that sex is not a penetrative one only. Sex is coziness, sex is enjoying the time together. Yes, being with the partner. कहते हैं ना, बुढ़ापे में तो पार्टनर की ज़्यादा ज़रूरत होती है. एक दूसरे के साथ टाइम बिताना और एक दूसरे के साथ रहना always makes a person young. And here, age is just a number. So in April 24 only, when the age bar was removed, so she is the Miss Universe, at the age of 60, she won that crown, yes, and she was there. The lady who won this Miss Universe crown is 60 years old lady. So age is just a number, sexuality is always there, enjoy that and be positive about that. Thank you so much.
It was very true for the Dr. Poonam Mishra. I was using dashing word. This is very true. Everybody have listened and enjoyed also.